Welcome to this explainer. Today we're diving into a really vital but honestly often overlooked topic, the role of dentist supervision in clear aligner treatment. We're going to be using some fantastic insights from ClearPath Orthodontics to help us separate the marketing myths from the clinical realities. Because let's face it, if you've ever even thought about straightening your teeth, you've probably noticed that aligners are absolutely everywhere right now. But here's the thing, behind that simple, clear piece of plastic, there is a highly complex medical process happening. And who is actually overseeing that process? Well, that matters immensely. Okay, let's just tackle a massive misconception right out of the gate. Because a lot of people think clear aligners are just a basic consumer product, right? Like something you can just order through the mail, pop into your mouth, and boom, magically get a perfect smile. But are all clear aligners actually created equal? Or is there a completely fundamental difference between a result you're going to be proud of and one that could actually cause you some serious long-term problems? Well, the simple truth is this. Moving teeth is not a quick cosmetic fix, like getting a haircut or whitening your enamel. Not at all. Because your teeth are intricately connected to bone, to tissue, and to deep roots, moving them is a serious clinical procedure. You are literally, physically shifting living roots through solid bone. To really understand why this matters so much, let's quickly run through our agenda for today. We're going to cover the aligner illusion, the hidden clinical risks, supervised versus unsupervised care, the clear path difference, and finally, we'll ask the big question, is it worth it? All right, kicking things off with part one, the aligner illusion, and what is actually happening below the surface. You know, before a single aligner tray is even manufactured, a dentist is looking for critical clinical factors that are completely invisible to the naked eye. An at-home kit? It simply cannot detect active gum disease. It can't see the length of your roots to assess the risk of them shrinking, or properly map out how your existing crowns are going to react to all that pressure. Honestly, if you skip a professional clinical assessment, you are flying completely blind when it comes to what's happening just below your gum line. Which brings us right into section 2, the hidden clinical risks. Because again, we are dealing with biology here, not just aesthetics. So teeth don't just slide around smoothly in your gums. They actually move because of sustained, highly controlled pressure that gets applied to something called the periodontal ligament. That's the vital tissue connecting each tooth to the surrounding bone. When the right amount of force is applied, your bone literally remodels in real time to safely accommodate that new position. It's an amazing process. But when that pressure is just guessed at, the results can range from mildly uncomfortable to highly, highly damaging. For instance, if an unsupervised DIY aligner pushes too hard or too quickly, it can trigger something called root resorption. This is a permanent and completely irreversible shortening of the tooth root. On top of that, if force is applied to a tooth that already has undetected bone loss, it can accelerate that loss dramatically. And the really scary part, you probably won't even notice this irreversible damage is happening until it is way too late. And beyond that root damage, we are seeing real, well-documented casualties from DIY orthodontics. We're talking about teeth moving in the entirely wrong direction because of poor case planning. We're seeing worsened bite alignments that require massive, complex corrections later on. There's gum recession from compromised tissue and even complete relapse shortly after the treatment ends because the retention phase wasn't professionally managed. The clinical decisions surrounding aligners, like which teeth to move, in what exact sequence, and with how much force, those are crucial medical judgments. They are not just administrative choices. Okay, moving to section 3, supervised versus unsupervised care. And let me tell you, it's a stark contrast in standards. The night and day difference really begins right at step 1. With a supervised treatment like ClearPath, you are getting a full clinical exam, x-rays, a bite evaluation, and a digital treatment plan that is extensively reviewed by a dentist. With those inadequately supervised DIY treatments, you're entirely skipping that clinical assessment. There is no dentist reviewing a plan that's tailored to your specific clinical needs. So the foundation of your entire smile is either being carefully engineered from day one, or it's literally just being left to chance. And that gap between the two approaches, it usually blows wide open mid-treatment. Think about it. If your teeth suddenly stop tracking correctly in a supervised plan, your dentist steps in. They do active problem solving, ordering refinement trays, adjusting the plan on the fly. In an unsupervised model, there's little to no monitoring and absolutely no structured process to identify or fix those deviations. Plus, at the very end of it all, professional retention planning is what actually keeps your teeth straight for life, whereas unsupervised models usually just leave retention entirely up to you. Let's move into section 4, the clear path difference. This is really what accountability in action looks like. Let's trace how potential issues are caught before a piece of plastic ever even reaches your mouth.
First, your specific case is simulated using ClearPath Smile Simulation Software, CP Smart 2.0. Then, a certified dentist reviews and actively modifies that plan. But it doesn't even stop there. ClearPath's own in-house specialists also cross-check the plan for safety. Finally, your dentist tracks everything through a dedicated portal, so you are never, ever relying on just one set of eyes.
People often assume that aligner checkups are just a quick formality. But when you visit your dentist every 6 to 8 weeks, they aren't just glancing at your teeth, giving a thumbs up, and sending you home. They're actively performing 5 critical, methodical assessments. They do tracking verifications, soft tissue assessments, attachment integrity checks, bite evaluations, and refinement planning if anything is drifting even slightly off course. This right here is the secret to keeping your treatment predictable. Now, for our viewers in Pakistan who are looking for invisible braces or clear aligners, this distinction is massive. ClearPath works exclusively through a network of trained dental professionals across the country, whether you're searching for an orthodontist in Lahore, Karachi, Islamabad, or anywhere else. This guarantees that you have direct access to proper clinical oversight right in your city, rather than just getting a product delivered in a cardboard box to your front door. All right, bringing us to our final section, Part 5. Is it actually worth it? Let's talk about the cost of getting it wrong. Consider the crazy complexities of a real human mouth for a second. Things like implants, they absolutely cannot be moved, which radically changes how every single surrounding tooth has to be planned out. Existing crowns and veneers change how and where attachments can even be placed. A mail-order kit has zero mechanism for addressing these complex curveballs. You really need a professional to factor these nuances into your unique plan and to instantly order those refinement trays if a tracking deviation occurs. Now, yes, thorough clinical supervision does cost more than a basic at-home package, but that difference reflects something very real. It covers the clinical assessment, the constant monitoring, and the expert professional judgment that literally keeps you safe. It's not simply a cheaper version of the exact same thing, it is a fundamentally different standard of care. Getting it right the very first time with clinical supervision is ultimately the most economical choice. Why? Because fixing the damage, like gum recession or ruined bite alignment from a DIY kit, is almost always way more expensive and far more invasive than the original proper treatment would have been. Ultimately, underneath those seemingly simple plastic trays is a very real medical process involving your bone, your tissue, and your roots. So I'm going to leave you with a provocative thought to ponder today. Are you willing to risk your permanent teeth on an unsupervised shortcut, or will you choose proper clinical guidance? If you're ready to explore your options with a professional who is genuinely accountable for your smile, you can find a trained provider near you over at clearpathortho.com. Thanks so much for joining me on this explainer, and keep